Welcome to our video on visualizing global type 2 diabetes prevalence. In this video, we will explore the economic impact of diabetes, the global prevalence of diabetes, the burden and trends in the complications of diabetes, and conclude with recommendations for national and global action. Let's dive in and gain a deeper understanding of this critical health issue. Welcome to our scientific teaching video on visualizing global type 2 diabetes prevalence. In this video, we will explore the economic impact of diabetes, the global prevalence of diabetes, and the burden and trends in the complications of diabetes. Let's start with the introduction to set the stage for our discussion. Next, we will delve into the economic impact of diabetes, shedding light on its implications for healthcare systems and economies worldwide. Then, we will visualize the global prevalence of diabetes, providing insights into the scale of this public health challenge. Following that, we will examine the burden and trends in the complications of diabetes, highlighting the associated health risks and implications for patient care. Finally, we will conclude with recommendations for addressing the global type 2 diabetes prevalence. Get ready to gain a comprehensive understanding of this critical health issue and its implications for global health. Let's dive in. Diabetes is a chronic disease characterized by high levels of blood glucose. Type 1 diabetes results from the body's failure to produce insulin, while type 2 diabetes occurs when the body cannot effectively use the insulin it produces. Gestational diabetes develops during pregnancy and may resolve after the baby is born. Other specific types of diabetes result from specific genetic conditions, surgery, medications, infections, and other illnesses. Genetics and family history can increase your risk of developing diabetes. Excessive weight gain, poor dietary habits, and physical inactivity are significant risk factors for type 2 diabetes. Smoking and gestational diabetes during pregnancy also contribute to your risk. Early childhood nutrition and birth weight play a role in your risk of developing diabetes later in life. Diabetes can lead to various complications, including heart disease and stroke. Kidney failure, vision loss, and nerve damage are common complications of uncontrolled diabetes. Uncontrolled diabetes in pregnancy can have devastating effects on both the mother and child. Diabetes also increases the overall risk of premature death. Diabetes and its complications lead to substantial economic loss through direct medical costs for hospital and outpatient care. The rise in cost for analog insulins, despite little evidence of significant advantages over cheaper human insulins, contributes to the economic burden. Total global diabetes health expenditure is expected to continue increasing, with low- and middle-income countries bearing a larger proportion of the future global healthcare expenditure burden. Diabetes imposes a large economic burden on individuals and families in terms of higher out-of-pocket healthcare payments and loss of family income associated with disability and premature loss of life. The economic impact of diabetes results in substantial loss of work and wages, affecting the productivity of individuals and families. The estimated losses in GDP worldwide from 2011 to 2030, including both direct and indirect costs of diabetes, are projected to total $1.7 trillion, with high-income and low- and middle-income countries sharing the burden. The economic impact of diabetes leads to large economic losses for health systems and national economies, affecting the overall economic stability. The estimated losses in GDP worldwide from 2011 to 2030, including both direct and indirect costs of diabetes, are projected to total $1.7 trillion, with high-income and low- and middle-income countries sharing the burden. Diabetes imposes a significant economic burden on people with diabetes and their families, contributing to the economic challenges faced by national economies. The global prevalence of diabetes has nearly doubled since 1980, rising from 4.7% to 8.5% in the adult population. This increase reflects the rise in associated risk factors such as being overweight or obese. Over the past decade, diabetes prevalence has risen faster in low- and middle-income countries than in high-income countries. As you can see, The increase in diabetes prevalence has occurred faster in low and middle-income countries than in high-income countries. Additionally, the percentage of deaths attributable to high blood glucose or diabetes that occurs prior to age 70 is higher in low and middle-income countries than in high-income countries. Visualizing the global prevalence of diabetes reveals a concerning trend. The increase in prevalence is stark, especially when comparing low and high-income countries. This has led to higher than optimal blood glucose mortality, causing an additional 2.2 million deaths and increasing the risks of cardiovascular and other diseases. Shockingly, 43% of these deaths occur before the age of 70 years. Uncontrolled diabetes can lead to complications in many parts of the body, including the heart, blood vessels, eyes, kidneys, and nerves. This can result in serious damage, such as reduced blood flow, increased risk of heart disease and stroke, diabetic retinopathy, leading to blindness and kidney failure. Diabetes caused 1.5 million deaths in 2012, and higher than optimal blood glucose caused an additional 2.2 million deaths. 43% of these 3.7 million deaths occur before the age of 70 years. The percentage of deaths attributable to high blood glucose or diabetes that occurs prior to age 70 is higher in low and middle-income countries than in high-income countries. Diabetes imposes a large economic burden on the global healthcare system and the wider global economy. The direct annual cost of diabetes to the world is estimated to be more than $827 billion, and the total global healthcare spending on diabetes is expected to continue increasing. Low and middle-income countries will carry a larger proportion of this future global healthcare expenditure burden than high-income countries. World leaders have committed to reducing the burden of diabetes as one of 4 priority non-communicable diseases, NCDs. They have set an ambitious target to reduce premature mortality from NCDs, including diabetes, by 1/3, achieve universal health coverage, and provide access to affordable essential medicines, all by 2030. Prevention and management strategies for diabetes are crucial. You need to focus on population-based prevention and early diagnosis for people at high risk. Access to essential medicines and technologies, along with integrated management of diabetes and other chronic health conditions, is important for effective management. Establishing national mechanisms for political commitment, resource allocation, and effective leadership is essential. Building the capacity of ministries of health to exercise a strategic leadership role is crucial. Prioritizing actions to prevent people from becoming overweight and obese is important. Ensuring equitable access to essential technologies for diagnosis and management is crucial.